Welcome to Mainland, your local regional television station, coming to you from the Nelson and Tasman region. In today's news, fire guts house in Stoke, Operation Country Roads 2, revaccination offered to pupils, housing crisis theory investigated, ill man airlifted from Nelson Lakes, a 73-year-old man remains in Nelson Hospital after suffering burns in a house fire in Stoke on Monday afternoon. At around 4:30 p.m, police, ambulance and fire crews rushed to 783 Main Road, Stoke, where the fire was well involved at the man's home when they arrived. It's understood the elderly man was inside the house when the blaze broke out, but managed to escape to the rear of the property. Stoke fire crews were first at the scene, but despite their valiant efforts, the fire is said to have completely destroyed the man's home. The 73-year-old was transported to Nelson Hospital with burns to his face and other extremities. Fire investigators have been at the scene to try to determine the cause of the blaze. Nelson Marlborough District Health Board Communications Advisor Catherine Rock says the man is in a comfortable condition in Nelson Hospital. Nelson Bays Police conducted a 3-day joint road policing and collections operation with bailiffs from the Ministry of Justice working alongside police over the weekend. Operation Country Roads 2 focused on drink driving and the collection of outstanding fines and reparations owed to victims of crime. Between Friday and Sunday, police and bailiffs visited around 100 Nelson addresses in an attempt to locate people with outstanding fines and/or reparation owing. Bailiffs seized 11 vehicles and a range of property including cash, Xbox, cameras, guitars, cell phone, a TV and other personal assets. The total collected was $196,000, with $30,000 of that being reparations owed to victims. The operation was part of an ongoing initiative between police and the Ministry of Justice and was the second joint operation in 6 weeks in Nelson Bays. Senior Sergeant Grant Andrews says people needed to be aware that if they left fines or reparations unpaid, there was a very real risk they would have other property seized in lieu of that payment. Anyone who still has outstanding fines should contact the court or 0800 4 fines to arrange payment. As a result of the operation, 6 people will also be facing drink driving charges. Senior Sergeant Andrews says police were disappointed at the high level of intoxication of these drivers, with the majority exceeding 800 milligrams per litre of alcohol, double the legal limit, and still choosing to drive. One of these drivers was involved in a non-injury crash at Motueka. They will all be appearing in the Nelson District Court in the coming weeks, facing charges of driving under the influence of alcohol. Police also issued in excess of 116 infringement notices for offences such as speeding, no registration or warrant of fitness, and failing to stop for red lights. 87 children in Nelson and Tasman have this week been offered another vaccine dose to ensure they are fully protected, as the most recent vaccines they received may have been rendered ineffective due to them being kept at too cool a temperature during transport to schools. Nelson Marlborough Medical Officer of Health Dr Ed Kittle says temperature data has revealed the vaccines had a short period of time in a chilli bin that went below zero on a journey to schools. Vaccines should be stored at temperatures between 2 and 8 degrees, and some vaccines are particularly sensitive to exposure to 0 degrees and below. Dr Kittle says the DHB has contacted parents and apologised for this incident and, based on external expert advice, recommended revaccination to ensure the children receive the appropriate levels of immunisation protection. Dr Kittle says the school-based program was temporarily put on hold until they were able to introduce solutions to prevent this occurring again. A 62-year-old male from the Tasman region was airlifted from the Nelson Lakes area on Monday afternoon by the Nelson Marlborough Rescue helicopter. The male had been tramping with others and felt unwell, so remained in a hut on the Derville River while his friends continued for a half-day return trip. He became increasingly unwell and activated his personal locator beacon. RCC New Zealand from Wellington dispatched the helicopter around 4 p.m. to locate the beacon. The man was assessed on scene by the helicopter's intensive care paramedic and taken to Nelson Hospital for further treatment. And now Maidenland's Chrissy Small investigates whether Nelson is having a housing crisis. The latest OECD report shows that New Zealand's house price inflation is the highest in the Western world and indicates the country has a real housing crisis, according to Labour spokesman Phil Twyford on TV1 News this week. The report did find that at 8.2%, New Zealand's house price inflation was the highest in the Western world in 2013. The report also found that compared to rents, New Zealand has the most overpriced housing market in the OECD, with house prices 70% too high and 32% too high relative to wages. Mr Twyford says the government's own budget figures shows it's costing someone on an average wage 49% of their pay to service an average mortgage. He says commentators have pretty much agreed the budget did next to nothing for the housing crisis. Although the report's focus was affordability and home ownership, the spin-off for renters would be an increase in rent prices. Mainland's Chrissy Small spoke with Carrie Mosina of the Nelson Women's Centre this week about whether she was seeing anything to suggest Nelson was experiencing a housing crisis. We also went to the streets of Nelson to ask people if they thought there was a housing crisis in the region.
Carrie Mosina, we've just had the news from via Labour that there's a housing crisis amongst people who wish to buy houses. It's getting less and less affordable. More income is going towards housing. This purchasing of housing, it doesn't just equate to people wanting to buy, it also trickles down to the renters, doesn't it? All this extra cost.
Absolutely, absolutely. I mean, here at the Women's Centre, we serve about 3,000 women a year, and I would say at least half of them are struggling to afford the rental homes they're in. And when I say struggling to afford, I mean, we talk to people whose housing costs is over 50% of their weekly income. So whether they're working or on benefits, in a stable relationship or not. And it's huge. There is a housing crisis in Nelson. Actually, I think there's a housing crisis all across the country.
Have the numbers increased in recent times?
Well, they've increased since 2000. I mean, we started, I know, because I've been in this role since about 2001, between 2000 and 2008, the cost of housing in Nelson, that's whether to rent or to buy, doubled, and incomes didn't. And there's a similar story all around New Zealand, and part of that is due to international funding pressures. But we saw it particularly impacting people on low incomes, on fixed incomes. And so, I mean, we're one of the places that said, okay, you know, we need to start being part of the solution, not just complaining about the problem. Here, a number of us helped start the Nelson Tasman Housing Trust. I'm one of the founding trustees. The Nelson Tasman Housing Trust now has 32 homes that we rent at affordable rents. And that is 80% of the current market rent. And we're in the process of, I think we've got 2 other projects in line, so we've got another 6 or 8 houses in the pipeline, but they won't be ready till end of 2015.
There's a shortage of rentals, isn't there?
Well, there's a shortage of affordable rentals. I mean, there's plenty of houses to rent out there, but what people can afford on their incomes, that's really tricky. And I mean, just think about it. If half of your weekly income, whether you're making $200 a week or $1,000 a week, if half of it is going on rent, that's really hard. You know, for a single person trying to rent, often they're paying $220, $230, $240, and I mean, that's just in rent. You know, if you're bringing in $300 a week, what, you've got $50 or $60 to, you know, buy food, petrol, pay the power. That's really, really hard. One of the interesting, I guess, national developments, you know, central government developments is what the current government is has done is a change in policy. They're saying, okay, Housing New Zealand is no longer the only provider of social housing in the country. They're trying to enroll a number of other community housing providers to be social housing providers. What that means is that you have to go through a lengthy approvals process. Our housing trust has done that. But what that means is we will be able for new tenants to charge income-related rent, not just an affordable rent. So eventually that will make a big difference for our tenants. But it's a very complex, tricky situation up and down the country, for sure.
And there's no quick fix?
Not at all. It's a very complex situation. There's a lot of factors. Some of them New Zealand has control over, and a lot of them New Zealand doesn't.
Breast cancer survivors turned out in force for the Nelson Regional Breast Cancer Trust's inaugural Survivorship Day held on Friday. Almost 100 delegates attended the special day. The conference was specially developed for breast cancer patients and their carers and focused on moving forward with life beyond treatment for breast cancer. Guest speakers and healthcare professionals presented sessions throughout the day aimed to help delegates understand the facilities available locally in terms of follow-up medical care and support services. Topics covered included dealing with the physical and emotional effects of treatment, the importance of exercise and nutrition, and lingerie options post-surgery. All delegates were given a survivor's passport with useful tips for managing health and recovery, written by guest speaker Andrea Fairburn, herself a survivor and founder of Breast Cancers Nirvana, breastcancernirvana.co.nz. The survivor's passport is available in a downloadable format on the Trust's website. Dr. Kate Gregory, medical oncologist and Nelson Regional Breast Cancer Trust trustee, was very happy the event had been so well attended. She says as far as she's aware, this is the first conference of its kind in the country, so the Trust was thrilled with such a great turnout. She continues the feedback from delegates was extremely positive, with many calling for the day to become a regular event. After the break, we'll bring you the latest weather update and some events and happenings coming up from around the region.